Maternal, Adolescent, Reproductive Child Health Match Care Initiative has advocated for the capacity building of healthcare workers and caregivers to achieve optimal nutrition in maternal and infant feeding. Mrs. Lawal Aiyedun-Olubunmi, President Match Initiative, made the call in Abuja at a 3-day training on nutrition for children with special needs and feeding difficulties supported by USAID. The World Breastfeeding Week WBW is commemorated annually from August 1 to 7 with the 2023 WBW theme tagged Enabling Breastfeeding, Making a Difference for Working Parents.
We're having a 3-day workshop for caregiver, the parents and other significant others that take care of our children with special needs. But we are focusing on children with cerebral palsy. We are focusing on the children with cleft lips and cleft palate, and also spina bifida. It's been an exciting time for us, sharing the burden and the pain and the challenges of bringing up a child with special needs in this country. We've learned about how communication plays a significant role. We've learned about how even the society has failed the people. And we are also calling on the same government, under our own president, to please take care. Let's join hands, because government cannot do it alone. But we want to join hands, including our friends from the media, to create a lot of awareness around prevention. Prevention is cheaper and is the best of this condition.
Pauline Ada, USAID Maternal, Infant and Young Child Nutrition Advisor, said the week was important to push and advocate for optimal breastfeeding for children. Ada stressed the need for mothers to practice early initiation of breastfeeding and exclusive breastfeeding from birth to 6 months and continue breastfeeding from 6 months to 2 years and beyond with complementary foods.
Breast milk is considered the best food ever. It is nature's gift to a child. Supporting the Match initiative to also sensitize and advocate for optimal breastfeeding for children with special needs or difficulties is also very important. I think it's very important that we do not neglect those who have challenges. My call is to advocate for more activities that would speak to this. It could be capacity building for health workers to know how to take care of caregivers with children with special needs.
Dr. Dennis Shetima, Chief Consultant Pediatrician, said taking steps to help ensure healthy pregnancy can prevent cerebral palsy, a damage or abnormal development in the part of the brain that controls movement. Shetima decried the lack of professionalism of some health personnel in communicating the right information to parents about their children. He said such breach in communication and acts of negligence from health workers could have severe effects on children, which could lead to defects.
We are fond of using medical jargon that doesn't make sense to them. They don't know the sense of urgency. You have to break it down to the level they understand so that you'll be on the same page. And surprisingly, once they get the message correctly, you get their cooperation very well. I wholeheartedly agree there should be training and retraining and sanctions, because it's not necessarily punitive measure, but corrective measures. So once you look at it that it's a corrective measure, not necessarily punitive function, it's welcome, and it should also serve as a deterrent to others that wants to follow such path.
Mrs. Rebecca Jacob, a parent, appreciated Match initiative for the opportunity to learn from experts on how to feed her son with cerebral palsy the right nutrition to aid his development.
To bless God for the organizer of this program. Indeed, I've been waiting for this opportunity because there are so many questions that have been on my mind, who to ask, who will give me the right answer, where to go, when will this whole thing end. And I thank God today, when Dr. Shetima was on the lecture, I learned so many things, that is only God, which is that God I've been trusting since 8 years, and one day it will all come to an end. I don't want to lose hope I have faith because Emmanuel Jacob is the only boy I have, and I waited for him after 3 days, and he came. And this is what happened. I accept it with faith. I knew it will end one day.